Good afternoon and welcome to our continuing Community Connections webinars that we've been hosting. My name is Steve Jewell with CommunityGiving, and with our various partner foundations, we're very pleased to welcome you today as we have a conversation about equity in healthcare access. We started this series actually back when the COVID crisis started. And in particular, after the murder of George Floyd, we felt it was very important for us to be focused, as many organizations, on diversity, equity, and inclusion. And we've been having these webinars on a regular basis to create conversation, to help continue the education that all of us are seeking and find ways to do things better than we've done them before. So we greatly appreciate all of you joining us today. We have a number of people who will be with us and others who are not able to be here, but they like to register. And of course, all of this is available afterwards as a recording, so you can watch it later if you, for whatever reason, need to leave in the middle of the webinar. So we'll give people just a minute or so or less here just to gather in the room. We see a number of people logging on. We have a few more people registered than that, so we'll just give them a couple minutes to get in. And see that they're logging in. Okay, well, I think we'll just get started, and I'm going to turn things over to the Executive Director of the Central Minnesota Community Foundation to introduce our first speaker, Carol Purnell.
Thank you, Steve. Good afternoon, everyone. We're excited to be able to talk about healthcare today and equity. So our first speaker will be Mahado Ali. She is a trauma-informed care project specialist at CentraCare. She is also a consultant for minority businesses. Mahado holds a BA in community health and a master's degree in business administration, and she's currently pursuing a PhD in business management leadership. For more than 10 years, Mahado has studied and extensively fought for health equity and social determinants of health, and has actively engaged in bringing attention to those issues. Her work focuses on socioeconomic and racial ethnic disparities in health. And she's here to share about experiences through CentraCare. Thank you, Mahado. Welcome.
Thank you so much for having me today. I'm very happy to be here. I would like to start out by saying that I'm happy to be here, and I've worked for CentraCare for the last 5 years. Prior to that, I worked as an interpreter, and I've done a variety of other work through the community, and I am very excited to be able to give this presentation and share some of our work and experiences. I would like to start out by saying that CentraCare is committed to creating and maintaining a diverse and inclusive culture throughout our entire organization. As an organization, we understand that reducing healthcare disparities brings us closer to reaching health equity, and it is important to understand that health disparities are differences in health outcomes and their causes among groups of people. Reducing health and eliminating health disparities is fundamental to reaching health equity and building a healthier nation. We strongly believe in putting strategies in place that create an environment where each of our employees and patients feel that they are accepted, included, and valued. Respecting diversity has been a very big thing for CentraCare and is always important to us, especially in healthcare, which allows us to be more equitable in what we deliver as an organization. When we talk about health and healthcare in the US, I think that we would all like to imagine everyone thinks that we receive the same high quality of care, but that's not the case for many of the communities that I personally work with, specifically the communities that are speaking different languages and minority communities. And a lot of these disparities that we see within the healthcare system in the US are the results of poor economic and environmental conditions. Race can also play a major role in healthcare equality. Inequality comes in many forms for people of color, both here and abroad, but race-related health disparities are among the hardest and resistant to progress. We found that African Americans and Native Americans and Hispanics tend to have higher rates of disease and illnesses. African American children are more likely to die from asthma compared to non Hispanic white children. African American adults are at least 50% more likely to die prematurely from heart disease or stroke. Our immigrant our immigrant community and population we consider to be most vulnerable population, since they have very unique and different challenges that include socioeconomic background, immigration statuses. Some of the families and patients that we work with are not here legally, so they don't have the documentation to receive healthcare and proper um, insurance that they need. Also, limited English proficiency has been another challenge and a factor. And then there are federal and state and local policies on access to publicly funded healthcare, especially when it comes to status and income guidelines. Residential locations had made it difficult for some of our populations to have access to healthcare, and some of the stigmas that exist around mental health and cancer and variety of other things have made it difficult and made it vulnerable for the population, the immigrant population, which created a lack of trust in the healthcare system. When it comes to the minority community, there is a lack of trust in the healthcare system because the history speaks for itself, especially with the racial injustices that has been occurring. COVID-19 has brought out many of these challenges that minority communities face. And some of the challenges are even something as small as social distancing, which is an issue. We had no idea this was going to be a huge issue, but a disproportionate number of minorities live in a small apartments and a house in which is difficult to isolate when a person has COVID-19. So as a healthcare team, we have looked through sources and resources and reached out to community organizations to help us figure out how we can provide hoteling or an isolation space for the family member who has COVID-19. It also was difficult for family members who had larger families when the mom had COVID-19 and is a single mom and had many children who would be helping her and who will take care of the kids, and then work and everything else comes into play. In addition to frontline service workers, they didn't have the luxury of staying at home and teleworking, so like many of us have had. So working individuals had no insurance, and it was impossible for them to get their services and the healthcare that they need because they were on a income cap, because they have made too much to qualify for Medicaid. We also found that food insecurities was another factor to this. So we created a food project which served over 900 families, and we tried to connect families to resources and connect with other organizations that are doing the same. Challenges rose with e-service visits such as e-learning and e-visits with education, and we worked towards that by partnering with local organization. We understand that reducing health disparities could be a difficult thing, but we partnered with organizations to raise awareness and bridge the gap in minority health. We believe that everyone should have the opportunity to be as healthy as possible, and recognize that collaboration with community service can make a huge difference, especially when working with immigrant population. The main cause of health disparities is access, and not necessarily access to healthcare as you may think, but access to basic needs can impact the health disparities. It is critical to have access to high quality education, safe neighborhoods, affordable housing, reliable transportation, clean environments, nutritious food, and stable employment. Ultimately, health is adversely affected by social circumstances. Without transportations, our patients will not be able to attend their appointments. Without educations, our patients may not be able to understand their health conditions or the illnesses, the symptoms that they're experiencing of those more serious illnesses. And without housing, we may not be able to provide a safe space in conditions like weather conditions like today and what's happening, especially during this pandemic. So as CentraCare organization, we are committed to reducing disparities in healthcare qualities among racial and ethnic groups. We do this by implementing quality improvement initiatives. CentraCare continues to identify and address implicit bias that could hinder patient and provider interactions and communications. We work with population health and education department to follow up with our non-English speaking patients who are discharged from the hospital to go over their treatment plan, and also to help them better understand by a bilingual nurse. We provide medical interpretation services to our patients. We understand the lack of trust in healthcare system, and to address that, CentraCare is working hard on diversifying its staff. Minority providers have been hired at the OBGYN clinic, in Long Prairie Clinic, at the hospitals, at the local clinics, and other areas in CentraCare. We have multiple employee minority grants that encourage further healthcare careers and other careers in the organization. We hired bilingual staff and continue to make the effort of increasing diverse staff by creating a career path for minority high school students and for our current employees. The high school student program is called Career One, and it is in partnership with the Boys and Girls Club, as well as the Technical College in St. Cloud State are some of the other key holders. We have Hispanic and community health workers and trauma-informed care team that work with communities to reduce cultural barriers to care and connect patients with community resources, especially during this pandemic. Our bilingual team works with the Hispanic community and the Somali community in overcoming language barriers and challenges in the healthcare. CentraCare continues to improve minority patient experience by adding several halal options to our patient menu, meaning foods are carefully prepared and processed according to Muslim culture and traditions. We found that many of our Muslim patients have had to go through family members to bring food. So what can residents do? Residents can collaborate with other organizations and also create programs in all areas of employment, culturally appropriate food shelves, free health clinics, housings, new, basically winter coat, drive, shoes, creating loans for finance grocery stores in underserved community, create voucher programs for housing, transportation, food, have community engagement, and work with others to fill in these gaps that exist. I would like to thank you all for having me here today, and we are strongly proud of our relationship with the community. We believe that it is essential, and there is no way that we can do what we're doing without the community's input. And my work here is one of the many initiatives here in CentraCare. We want people to feel liberated, and we don't deal with disparities. When we don't deal with disparities, what we're doing is denying people the opportunity to get back to the world. So we have to fight this. And as a community, we have to fight it with everything that we got together. There are a lot of organizations and programs that are happening in the community that I'll be more than happy to get everyone connected to. I'm very thankful to be here and to have some of your time today. Thank you.
Thank you, Mahado. My name is Sarah Carlson. I'm the Executive Director of the Wilmer Area Community Foundation, and it is my honor to introduce our second speaker today, and that is Dr. Cindy Firkins Smith. Dr. Firkins Smith is currently the Carris Health co-CEO and has practiced dermatology in the Wilmer and surrounding communities for over 30 years. She calls herself a lifer. Throughout that time, she has been committed to advocating for rural medicine, serving in multiple leadership capacities, including as the president of the Minnesota Medical Association. She is a lifelong learner and teacher. She's a clinical professor of dermatology at the U of M and recently completed her master's in healthcare innovation at the University of Pennsylvania. Her work also includes bringing awareness to and bridging societal inequities in healthcare delivery, rural health, and for people of color. Thank you for joining us today, Dr. Smith.
Hi, everybody. Can you hear me okay?
We can.
Wonderful. So I'm thrilled to be here today, and I appreciate the invitation. Mahado did a beautiful job of summarizing the significance of healthcare inequities for people of color and what CentraCare and Carris is doing to address some of those inequities. I'd like to just maybe expand on a couple of those things for the people who are attending today. First of all, my area of expertise is in rural health. And I'm very interested in disparities, specifically as they pertain to rural versus urban versus suburban health. When we add the disparities that being a person of color in a rural area factors into that, it adds even more concerns with the ability to deliver equitable health care. We know, for instance, that people get the best health care when it's delivered by people who look like them, who have similar experiences, who come from similar areas, who have similar challenges. And in rural America, that would mean that if you're a person of color, it would be best if you had healthcare professionals who had your similar experiences. And that's a challenge. We know that when it comes to physicians, for example, we are matriculating less rural physicians at medical schools than we were 20 years ago. And we don't know exactly why that is. So we have a lot of research and we have a lot of things to do to figure out why that's occurring. We also know that we're not accepting enough people of color into healthcare professions, particularly into medical schools, and we need to address that. And when you compound the challenges of getting rural physicians and physicians of color and try to put them both together in rural physicians of color, you're even more challenged. So as Mahado says, we're very committed from a CentraCare and Carris standpoint to expanding educational opportunities, not just for potential physicians, but for healthcare professionals in all areas of our organization to serve the people that we serve. And that's going to be very important moving forward. I think also really important to understand when it comes to the inequities in healthcare disparities from a delivery standpoint or physician and outcome standpoint is to understand why they occur. We talk about, for instance, people of color experiencing greater incidences, for instance, of diabetes, or perhaps in some instances having greater rates of obesity. And significant to that is that during the time of COVID, we've had people of color experiencing far greater risks for COVID and certainly far greater outcomes. The death rate is far higher in our people of color and they're hospitalized at a greater rate. And it's really important to understand that those inequities, the greater risks from COVID, the greater risk of diabetes, et cetera, have nothing to do with the color of one's skin. So there's nothing genetic about skin color and your increased risk for any of those diseases. It is simply due to decades of institutional racism and social inequities that have led to increased incidences of those diseases in our population of color because they simply haven't had the same access to good nutrition, the same access to exercise facilities, the same access to good health care that other people have had. One of the, I found most fascinating and most significant predictors of lifespan and healthcare outcomes is simply zip code, which is really interesting. Why would zip code have anything to do with the length of your life or your healthcare outcomes? And zip code, again, has everything to do with social inequities. Your opportunity to have access to healthy foods, your opportunity to have access to good healthcare and good housing. And again, that is associated with decades, aeons, more than decades, of institutional racism in this country. And so healthcare is more than just health. And when we think about health, we need to think about it in a far more expansive way than simply going to the doctor or taking medications. We need to think about it with access to housing, as Mahado has already pointed out, with access to good foods, with access to mortgages, with access to education, with access to all of those variables that will increase health, increase lifespan, and create an equitable environment for everyone in this country. So I'm very excited to be here, and I would be happy to join with Mahado and join with the number of other people here today to answer any questions that people might have.
Thank you very much, Dr. Smith. I just want to remind everyone that if you have a question that comes up during our conversation, please just drop it into the Q&A tab and I'll keep an eye on that. But we do have a few questions ready to go. And so one of the questions really ties into what both of you had started out sharing about the predictors of how well people of color do when their care providers and their liaisons look like them. And that certainly makes sense. So can you tell us a little bit about the biggest challenges to doing health outreach, particularly well care and preventative medicine for people of color? Is it, I think sometimes people think it's translation services or it's insurance. What are you as providers seeing on the ground as the biggest challenge?
Mahado, you're on the ground. Do you want to start with that one?
I'm sorry, can you repeat the question again?
Sure. What would you say are the biggest challenges to health outreach, particularly around well care and preventative medicine for communities of color in your area? Is it translation services, access to insurance, not having a medical provider or a medical home? What would be the biggest challenge?
The biggest challenge has been combining of all three that you've actually just mentioned. Some of the patients that we have, since the Obama insurance isn't required anymore, decided to opt out and don't have any health insurance, but don't meet the guideline to get free health insurance. So that has been a huge issue. The other thing is the lack of knowledge in terms of preventative health, since most of the communities that we work with came from, Africa, and Africa, there's no such thing as preventative health in those areas. You only go to the doctor when you need to go see. So, and lack of, understanding some of the medical things such as cancer not being a thing in our community, and now it is a major issue, and understanding traumas. So it has been a variety of things, and also translation, as well as transportation is an issue as well.
Thank you. Dr. Smith, is there anything you wanted to add?
Right. I think to add to what Mahado said, I think sometimes we expect particularly our immigrant population to maybe respond to what we have available to them. For instance, she made the comment that patients aren't maybe used to preventative health. And I think she's right about that. We've discovered that as well here, and we need to find a way to address that. But one of our challenges has been they're not really used to the way we maybe provide healthcare services. So for instance, making an appointment, coming in at a scheduled time isn't consistent with what they're used to doing sometimes. And so they're more apt to come into urgent care and depend on urgent care for what we would traditionally call preventative care services. And we'd like to change that paradigm. And so I think we need to work with our communities to do that. Because if we could arrange the preventative care that people aren't getting now in a way that works best for them in their social situation, we could improve their healthcare outcomes. So I think a lot of our challenges have been trying to make people fit into our system, which doesn't always work. But that is a challenge as well. The system is ingrained, and systems are sometimes very hard to change.
Thank you. There is a question in the Q&A tab that I think would be best for you, Dr. Smith, and that is, what can you tell us in terms of health equity in rural versus urban? Is there a difference in health equity rural to urban?
Well, I think it depends on where in urban you are and where in rural you are. So for instance, a lot of, excuse me, I'm losing my voice today. I think it's the weather. A lot of the inequities that currently exist are related to poverty. So if you're living in an urban area, but no matter what your external color is, if you have money, you're going to have less problems with inequity. And the same is true in rural areas. If you have funds and you have the ability to access transportation, you're going to have less difficulties dealing with inequities. One of the challenges that we have just in general is that rural areas in general tend to be older and tend to be poorer. And so that creates inequities from a transportation and an access problem that maybe are a little bit less difficult in urban areas. But again, I think it's hard to generalize the populations simply because it just depends on where in those areas that you're living.
Thank you. Mahado, I'm wondering if you could try a question for us. And knowing that most of our participants on our webinar series come from nonprofit backgrounds and other community-led organizations, or maybe some of our donors. Can you tell us a little bit or give us some thoughts about how we as community members could help bridge the health equity challenges that are present in our community today? We know that you as medical experts are working really hard on your end, but what could we do as community members and potentially as community foundations to assist you in this work?
Thank you. That's a great question. I believe that collaborating together and asking the community what they need. Oftentimes we make decisions without asking people from the community, what is it that they actually need to get to where they need to be at? So supporting local organizations and challenging policies that exist on the local level, state level, and federal level is critical to changing some of these issues that exist, some of these disparities that exist, like for example, the housing and health and other areas. Also supporting food shelves. I've noticed that the food shelves, we often send in patients from different cultures to some of the food shelves, but we don't eat canned foods. So supporting sections that are culturally appropriate or creating food shelves or nonprofits and incorporating that, and also taking the health and the services to the community instead of expecting them to come to us is another way that we can make a difference.
Thank you. And a slight twist on that question to you, Dr. Smith. I know from our partnership with Carris in the past, you are deeply involved in scholarships that assist people to pursue careers in the medical field. But what can we as community members do to help identify and lift up and encourage students of color to pursue careers in medicine?
And we were just talking about that actually. So let me just share an example. None of my kids went into medicine, right? But from an early age, they saw what I did. They were exposed to talk about healthcare. They saw the books I brought home. I had the opportunity to send them to science camp. I had the opportunity to buy them a microscope, things like that. I think that the kids that aren't exposed to that don't even think about those opportunities, not just in healthcare, but in STEM, science, technology, engineering, and math. And so I would encourage all of us to, in these fields, to reach out to communities where people aren't working in those fields, and maybe adopt some of these kids in some way, or go out into the communities and just create exposure. If I mentored a few of these kids at a very young age, because I think we've got to start exposing them when they're very young, we could perhaps get them thinking about it when it's possible. Because I think a lot of these kids grow up and don't, number one, even think about it, and number two, don't think it's possible. It would be pretty easy for a group of community members to donate money together and sponsor a young child of color, or a child that's disadvantaged, to go to a STEM camp or something, to just get them thinking along those lines. And then as they get older, to scholarship them, because it's not enough sometimes to just give them a $1,000. I mean, you're right, we've been very good about giving scholarships, but we've been talking about the difference between giving multiple scholarships to multiple people versus giving transformational scholarships, where someone who maybe has no opportunity would really have the opportunity to go off and go to medical school where they wouldn't otherwise, with the understanding that they come back and serve our community. I can give a student of color $1,000 scholarship, but that's not going to help them, because they can't do much with that money. Whereas if we endow them with enough money to pay for their undergrad and medical school education, now that would be transformational. So it's just a different way of thinking about things.
That would be transformational indeed.
We're trying to endow that now, and we're pretty excited about that. So,
Mahado, there's a question here I think might be best suited to you, and that is, what efforts are being made in rural areas to address differences in immigrants and people from other cultures in the way that they access healthcare?
We have community health workers in the rural area, in Melrose and Long Prairie area, that did a lot of outreach and education. We are currently hiring a Hispanic health worker, also an RN that we originally hired, but had to take a different role. We were working towards local grocery shops and supporting them, whether it's helping them find grants that they could provide culturally appropriate foods, or whether it's providing them with grants to make them better. And also doing some outreach. We have a Hispanic mental health worker right now added to our team. Our team is fairly new, so we're working towards that and working with other organizations to bring more resources to that area. So there are things that are up and going, but right now we have the Hispanic clinic that we do in Way Park area. So we have some families that would come from other rural areas and that don't have insurance that would come and get services. And that's how we're trying to bridge the gap. And there's some scholarship and fundings that are available through CentraCare to pay for some of the bills.
Great. So there's a question that was chatted directly to me, and it's a little different twist on health equity, and I thought it might be worth having some conversation. So we'll start with Dr. Cindy, if she's ready, and that is, how have healthcare organizations needed to change or evolve to support the transgender community, which is already traditionally underserved, and especially so when they're also a person of color?
That's a great question. CentraCare actually has a dedicated transgender clinic. And so I've been very, frankly, proud of the commitment that the organization has made to serving this population. Certainly, people of color are already a smaller portion of the population in our area than our others. And so people of color that are transgendered are in the even smaller population. But we are serving those right along with people that are not of color. I will tell you, transgendered people are underserved. We're making an effort, but they're simply underserved, and there's still a lot of stigma to this population that we are endeavoring to overcome, but we have a ways to go. The entire world has a ways to go, and certainly rural Minnesota does as well.
Thank you. This
And
question, go ahead, Mahado.
to add a little bit on to that, we have an employee resource group, which is called the LGBTQ plus ally group in CentraCare that helps and supports employees and patients within that group.
That is great. I'm so glad someone asked that question for us to learn more about work that many of us don't interface with on a regular basis. That's wonderful. So we've also heard that one of the challenges for people of color that live in rural Minnesota is understanding the importance of screenings for things like diabetes and colorectal and breast cancer. What does your organization do or need to do to educate people on the importance of these screenings? And is this a space for the community to be of assistance to you as medical professionals?
Well, you guys are answering these questions that we're asking right now. So thank you for that. And certainly Mahado can tag on to this. I'm going to address colon cancer screening or colorectal cancer screening, because that is a healthcare disparity that's kind of at the top of our list right now. In attempting to address healthcare disparities, we're choosing one that we really want to focus on, because we really want to change the paradigm. And this is at the top of our list to concentrate on over the next year. And the question is how to do that. I mean, how to address that disparity when people of our color and the people in our community and people of color aren't excited about colon cancer screening. And sometimes it's just that society in general is resistant, but sometimes people of color don't recognize the importance of it. And so we are looking to get out into the community with our community healthcare workers, with people like Mahado helping us to figure out how best to do this. And you know, perhaps to use stories from those who have suffered as a result of the disease to maybe share the importance. I'm sure people on the call know that Chadwick, I'm going to say his name, Chadwick Bosworth. I know I'm saying his name wrong. Our actor died of colon cancer this year and was a beloved guy in the community, and might allow us to increase awareness of this importance of this type of screening. So yeah, it is a constant challenge, and we're certainly open to input from community members that have any type of ideas on how to create better outreach to our community. Mahado.
To add on to that, in CentraCare, we have a couple of committees, one that focuses on health disparities in the minority communities. And some of the initiatives that we're doing are focusing on colon cancer, diabetes, and other areas. Also, in the past, we have done initiatives where we provided food boxes for about a year, and to see if the diabetes level and the lipid level will go down. And that had showed us that those numbers had improved by providing healthier food options. So we're looking at a variety of other things on how to educate that. But our team and the community health workers are working on registries for diabetes and colon cancer screenings. And we are doing a fit test. So instead of, most people don't want to do the solutions and go through all that process. So they would rather do the fit test or the Cologuard, which is good for 3 years, I believe, and the fit kit is good for a year to 2. So we're coming up with like creative ways to bridge that gap and meet the community where they're at, even if it means that I am picking up those Cologuards after they're done and running them back.
Thank you. Can you say a little bit more? One of the questions that was privately chatted to me was asking for clarification on what is a community health worker and how do they interface with more traditional medicine that we all think of when we go see our doctor at the clinic?
So I was a community health worker for 4 years at the Family Health Center. I was a community health worker, but I worked with everyone. As a community health worker, we are taught about different health and medication management, and just do a variety of different things, including social work. So we advocate for our patients, and we help our patients find solutions and resources to their needs. We are also bridging the gap between the provider and the patient by providing culturally appropriate education to our patient and help them understand what the provider needs them to understand. Sometimes we are just running something as dropping off the Fitbit, or the fit test, or the Cologuard, and sometimes we're educating about medication. So we are there to be liaison between the community and the healthcare organization.
Thank you. I know that we're seeing lots of benefits from those community health workers in our community area of Wilmer, and we hope that we can recruit a few more to go into that arena. Dr. Smith, can you share a little bit, this question is in the Q&A tab, about what CentraCare and Carris Health are doing to help recruit local people of color that might have some talent into roles, even if they're entry-level roles within the healthcare field, and what thoughts do you have about how we can help retain some of our college students who leave for the metro area because there aren't job opportunities in the healthcare field for them?
So our data suggests that we're fairly good about recruiting employees of color in our organization. We're less good with retaining them. And so we're studying why that is. I think one of the most important things that we need to do is when we bring any employee into our organization is we need to support them, and we need to make sure that they feel connected in the organization and they feel purpose. And so that's going to be important for our employees of color as well as all of our employees. We are committed from an organizational standpoint to seeking out people with a variety of different competencies, because we're going to be a better organization if we are well represented by people across the spectrum. We know that if you have women, and you have people of color, people with different backgrounds, people from different geographies, it just makes us a better organization. So we are committed to doing that. I think the way to specifically attract people of color is to seek them out and know that we are looking for them and want to support them in our organization. And what was the second half of that question, Sarah? I think it was two parts.
It was about the pipeline of people with talents that start here in rural and then they exit for larger urban areas because of career opportunity.
Well, if they want to work in healthcare, we have lots of career opportunities for them. So we would encourage them to come back home. We've got plenty of data that suggests that rural physicians, for instance, are born and not made. The data is overpowering that the best way to get a rural physician, and I will extrapolate this to other healthcare workers, is to raise our own and keep them here. And so I would propose that we get them interested in healthcare and STEM opportunities really early, make sure kids know that they are capable, that they are intelligent. We will support them in their development and their education, and then bring them back to the community. Our challenge isn't always our kids. Our challenge is when we send them off to the metro area or wherever we need to send them to be educated, they sometimes meet someone from somewhere else. And then we are challenged bringing them back, encouraging the spouse to come back, and making sure they have job opportunities here as well. And so that is our challenge.
That is an interesting line of conversation and thinking, though, for us as community leaders, that if you can get a physician or a healthcare provider prospect who's interested in coming home, how do we provide a high quality of life for the trailing spouse and ensure that they have meaningful work in our community as well, because we would all benefit from that.
So I will expand on that, Sarah. I just wrote I'm editing a textbook on rural dermatology and just wrote a chapter on how to attract a rural dermatologist. And there's very little data on this. So I had to expand into the field on how to just attract rural physicians and rural healthcare professionals. And it's very, attracting the trailing spouse is very important, but attracting the family is very important. And we've discovered in my 30 years of recruiting here that sometimes if we just attract the kids, sometimes we can get the parents to come. But what's really important is not just the job for the spouse. Sometimes they don't need a job, but they need some kind of purpose, whether it's volunteer work. And you need to have a really strong educational system and a really vibrant community. Because professionals and young families aren't interested in coming back to a community that's not strong, that isn't interested in committing and financing its school system and its parks and its recreational opportunities. All those things illustrate a vibrant community, and that's what they want to be involved in. So it's really important from a community standpoint that we recognize that if we want our professionals to come back to our communities.
Thank you. Another question in the chat box is that we are hearing a lot about, in the general population, about rising anxiety and depression and isolation and substance abuse in Minnesota right now. Many of these tie back to our current health crisis. What are you seeing, either of you, relative to social connectedness and mental health needs in communities of color right now as a side effect of the pandemic? Mahado, do you want to start?
Sure. In our communities, we're seeing a high level of drug use, especially substance abuse within our youth, because schools are out and they're staying at home. There's nothing for them to do. There's a huge gap between the first generation and the parents here, where the first generation are trying to fit into the community and trying to be a part of this, where families are not understanding. And then the pandemic and being at home in a smaller area and not being able to connect and do the things that they were doing different at school has had a major impact on the families that we work with. So we're seeing an increase in that. We're seeing an increase in depression and anxiety because of the closed space and, you know, so many children being at home, other families being at home, losing loved ones, not being able to, especially with our immigrant communities, you know, not being able to say goodbye to your loved one, whether they get the COVID-19. My dad had the COVID-19 and we were not able to say goodbye to him. So it has a major effect on us. And then the political climate, especially Somalis, you know, being a target right now and constantly being mentioned at the political things. And, you know, this is creating a huge anxiety and depression and fears in our communities, but also for the Hispanic community. And then racial issues has had an impact, especially since George Floyd. We're seeing anxiety go up and depression and everything. So it has been very challenging. I have a 6-year-old Black son, so his anxiety has definitely went up discussing this and seeing this and hearing this. So it has been difficult. This is a difficult time for the minority community, especially, you know, a lot of people are losing their jobs. There's a lot of uncertainty for sure that we're seeing.
Thank you. Dr. Smith, is there anything you wanted to add around this issue?
Well, I think 2020 can just go away as far as I'm concerned. It's been a rough year, horrible year all around. I listened to Mahado and my heart breaks. Everybody's stressed. The pandemic has created anxiety and stress and pressure like the majority of us have never seen in our lifetimes. And then to add the challenges that our population, our friends and neighbors face simply because of the color of their skin is simply untenable and simply unacceptable. I think the people that are on this call today recognize that, and that's why we're here, right? We're not willing to accept we're not willing to accept the institutional racism that has led us to where we are today. And so I think people are tired. I think people are have had enough, and I'm optimistic that the people who are calling in today will continue this work past 2020 so that we can make significant change so that Mahado's son can grow up in a world where he's not stressed out and doesn't have to worry about walking down the street and being at risk. We just have to make these changes happen. We must.
Thank you. As the mom of 2 Black children, I concur. The last question that's in the chat box is that many students of color are struggling with housing, food, and transportation right now. And we need to support them in that way. And that's a good reminder for us as community to think about that. But as medical professionals, what are your thoughts on how we can better support students of color and their families right now?
Well, I'll throw in I think we need to look at health beyond health, frankly. I've made the comparison many times that, and I'm a dermatologist, but from an internist or general medicine standpoint, we can prescribe all the insulin we want for our diabetic patients, but if they don't have a refrigerator to store it in it, we really haven't done much for them. And so we have to look at health beyond medications that we prescribe and tests that we do, and look at the whole social situation. People can't be healthy if they don't have a place to live, and they can't be healthy if they don't have food to eat that's healthy for them. And so we must stop siloing out how we think about health and how we think about housing and how we think about food access. And honestly, that comes down to just changing the way we advocate for these things nationally. And it's going to be transforming the way we think. And that's a big lift, but we've just got to keep the work up, and we've got to do it. I'm again optimistic that the way we change the way we reimburse healthcare, if we can truly change it and start reimbursing more for outcomes, that will make a difference in what we're willing to fund. For instance, if my patient needs an air conditioner so he doesn't have an outbreak of a COPD in 90-degree days in the summer, maybe I should be paying for an air conditioner rather than a bunch of expensive medicine that doesn't work.
That's an excellent perspective. Mahado, is there anything you wanted to add?
A lot of these things majorly impact my family and people that are close to me. So for me, as a healthcare provider, I've actually partnered with local organizations such as Arrive Ministry to provide tutors for families that are in need. I get calls every single day from parents that are saying that their kids are behind, but the mom doesn't know how to read or write. I've even collected iPads, tablets, computers to provide to families when the iPads were not working, and they still don't work that well. So our kids are behind. We came up with creative ways to tutor these kids, such as virtual tutoring, because some of these families are scared of bringing home COVID-19 to their sick grandma, since we have our grandparents that usually live with our family members. And just finding creative ways to bridge that gap, because making sure that the kids are receiving education means that the mom is less stressed out because she's not worried about her children being behind from school and social services being called on to. And now she's having all of these anxieties and stressors that are triggering her to feel sick and get all these other health problems. So just doing this smallest thing helps these families. We've also provided gift cards, to pay for their internet. I've even went to homes, just call the internet for them, because language again is a barrier. So making sure that we're thinking of the smallest way to help these families will make a great deal for them, and making sure that, the community is healthy, because it takes a village to raise a child. We have to come together at the end of the day.
Creativity and innovation are the answers. Thank you both very much. We appreciate your expertise. And at this time, I'm going to turn it over to my colleague, Carl Samp with the Brainerd Lakes Area Community Foundation. Carl?
Thank you, Sarah. Great job on the Q&A. And I just really want to compliment our speakers today. That was one of the most interesting webinars I think we put on, and you guys did a terrific job. And our thanks to your organizations for the work that they're doing in this area as well. Thank you also to everybody who attended today. We appreciate your time, and you can let other people know if they want to view this. They can view all of our past webinars, including this one, on our website at www.communitygiving.org/CommunityConnections. You can also find information on our COVID response and recovery grants on that site as well by going to communitygiving.org/COVID-19, as you can see on the screen there. So feel free to look for additional information in our Idea Center as well. So lots of information on our web. We encourage you to connect with any of your local executive directors of your community foundations for more information or information on grants and other resources available through us. Our upcoming webinars, we have a professional advisor and a webinar for individuals that want to learn more about estate planning, tax strategies, and legacy giving. It'll be on October 29th at 3 o'clock. We'll also have our next equity webinar on November 10th, and it will be equity and education. And then we have equity in banking and access to capital on November 17th coming up. And finally, another professional advisor event on December 8th with year-end giving strategies. Once again, we want to thank you all for being part of our day. Thank you to our speakers. Thank you to all my coworkers for the work you do in putting these together. And we encourage you all to be safe out there, especially if you're driving today. So a little bit of snow on the ground up here in Brainerd, and I'm sure where you are too. So thanks for being here, and we'll see you next time.
Thank you, everyone.